about monopolies. Our state constitution says monopolies are contrary to the genius of a free state and shall not be allowed, yet we have the largest healthcare monopoly in the country here, in the country. What steps can the legislature take to return the free market competition to healthcare and improve this area of healthcare? Would someone like to speak to that for 2 minutes? Senator Marshall.
So I've tried to look into this a little bit more detail since taking this position. And one thing that I found, and this is no excuse whatsoever, but when you look at the wage index for our region, we are actually reimbursed lower for the same service than we are for the rest of the state. So when we're reimbursed less for the same service, we're not going to get the same resources as Knoxville or Nashville or Memphis. And so and this is on wage indexes are not controlled by the state. They're all controlled by Medicare CMS. So one thing that I looked at, which I've learned in a short amount of time, resolutions are very powerful, but they can only go so far, especially when you're dealing with federal government. But that's one thing I've been looking at is how can we put this in front of Dr. Oz and CMS and have him reevaluate this, because we're not going to get any better. When I look at it this way, CON, certificate of need, has come up again with acute care, but the problem is, we talk about competition. Can I be transparent? I'm not very confident in our current situation in healthcare systems as of right now. When you've got HMG and United Healthcare /Optum, and then you've got the concerns that I have with SOFA and their turnover. And so my goal here is to have the absolute best healthcare system we can have, whatever that looks like. Once again, revert back to the wage index. Even if we were to do away with certificate of need for acute healthcare systems, who would move into this area? Because it's not cheap to build a hospital. I just want us to think about that, because once again, this is no excuse for quality of care, access of care, but when you look at not getting reimbursed for the same service, we're already behind the 8 ball. So that's just what I'm saying. Thank you.
Representative Hicks, 2 minutes.
And to sort of go along with what the senator is referring to, I dislike monopolies. I think that for a long time, a lot of people in Northeast Tennessee dislike it. But I actually met with some hospitals in Nashville. I called the CEOs, got them to my office, the 3 hospitals across Tennessee. And I asked them, I said, would you, if we could get something done with the COPA and with the CON laws, would you all build a hospital in Northeast Tennessee? They said, no way. No way they will ever build a hospital in Northeast Tennessee, because of the pay scales, because of the health care of the people here, because of the reimbursements. There's many reasons why they won't build a hospital here. And currently, what we're going through with our
But shouldn't we give them a chance to fail? If someone wants to build a hospital.
Sir, if they plainly, I brutally believe that it would be extremely hard to get a hospital built.
Right, I don't disagree. But shouldn't we lift the certificate of the common law?
I think that we need to work. I think that healthcare has changed a whole lot, and hospitals and healthcare altogether has changed a lot since all this was passed. I do believe that all of it needs to be looked at, okay? I do. But I also believe that we are very fortunate right now that currently what we're going through is healthcare in Northeast Tennessee. We are fortunate right now to have the monopoly that we have. We've got to figure it out, okay? But currently, there is no other options and choices. So, thank you.
Thank you.
One of the things that Representative Hicks and I looked at also was just the sheer fact that, like Tim said, if you don't have a hospital to come in, if you close Valley on Friday, you got to have a hospital come Saturday morning. we can't exist without any hospital. And that's a real problem that we've had. And so for things that we've supported, like all the other things that we have supported in this area to beef up the support system to try to help us get through this has been very difficult. For example, if you look at Caring Hearts opened a heart cath lab. We supported that. We wrote letters in support of that. And they cannot get the health care insurances to pay for anything. They can't get an agreement with them. They won't even come to the table to give them. They want to pay for a pacemaker. They don't even want to pay for the cost of the pacemaker. The insurance companies do. So it's this payer mix that these hospitals and these private groups are struggling with, and that's the biggest issue we've got. It's a very complicated situation.
Thank you.
Next question, you asked.
Rebecca, I have to agree with you. What we see a lot is our insurances are making judgment on our care.
Yes.
And we got to stop that.
Yes.
We need to have the doctor.
Right.
And a lot of people now cannot even afford to see a doctor, they see PAs.
Right.
And that could be a challenge for us in this area.
Yes. It's always going to be much more of a challenge when we're in a rural area. I sit on the Rural Health Task Force of the state, and it's huge issues to get the quality of care we want for our people. But we're trying really hard. And our biggest concern is that we want the best health care, like Dr. Hirschberger said, that we can possibly ever get. We want the best. We, at one time, had great health care in East Tennessee. I used to be proud to say, come move here because we've got great health care. You know, we want that again. And we're going to do everything we can in our power to help get that. And we've supported all these organizations like State of Franklin, HMG, Highlands Physicians, all of those, Watauga, Orthopedics, and Caring Hearts, trying to help them get the facilities and the things that they need to try to keep our health care at the best we can.
Thank you. Thank you.
Is there any reason why you can't, you brought two systems together to nothing about it? Why can't you start slowly breaking it apart and make it competitive?
Yeah, that was my
That's
point.
not easy, that's not gonna be easy, but you can move in that direction.
Well, that's the thing too, I think we forget,
And then let's wrap it up after this,
just
because
super
but
quick.
we could talk about this all night.
Yeah.
This is a huge issue. But
So I think sometimes we forget when we think of COPA and it was state sanctioned, but Balance a private company, that's the crux of it. And the COPA is overseen by the Attorney General's office, and then is it the Department of Health? Yeah. And so, once again, I want to try to figure out from a, even if it's a reporting standard, of showing this is why, because it's the certificate of public advantage. So all we want to do is just make sure we're getting that quality of care that we deserve.
thank you. We got to move on. I think Monty and Todd are about to go to sleep up here. They don't have a dog in that regional healthcare race. We'll keep this moving. Thank y'all though for caring about quality health care. It's a really tough issue.